You know, surgeons and physicians love to complain about prior authorizations and insurance denials. I'm guilty as charged as well. I hate it when a surgery that I think is right for a patient gets denied for a silly reason by an insurance company. But then there are days like today. The patient that I did surgery on was having right leg pain. He initially went to a pain doctor for this problem, who ultimately recommended a surgery that was essentially a fusion operation at the L4-5 level, where the pain doctor went in percutaneously and placed a spacer or a metal implant in between the spinous processes of L4 and L5 to achieve a bony fusion with the hopes of indirectly opening up the space around a pinched nerve that was causing the leg pain. Now, this actually worked temporarily for a short period of time, but then the pain came right back and the patient came to my office. So what did we have to do now? We had to go in, remove this implant that had created a bony fusion but had left a nerve pinched, and then go in and unpinch that nerve with the hopes of improving this patient's leg pain. That original procedure should never have been done, and it's frustrating because now we're sort of in a damage control salvage mode, trying to fix something that could have been done right the first time. And you know, this patient has a self-insured employer, which means that patient's company is the one that's cutting the checks for all these healthcare services. And that first procedure, that represents wasted dollars, wasted time, wasted functionality for that patient. If that employer had been able to steer this patient to the right provider for the right treatment at the right time, we wouldn't be in this mess now. And so, yes, while there are silly denials happening all day long, then there are stories like this, where silly interventions are happening, and if there was more appropriate steerage from the get-go, patients get better, get healthier, be happier, and be back to work faster. So I am so excited for what we're building with Mishi Health, where we are actually going to be implementing evidence-based, clinically specific, domain-specific care pathways that help steer employees to the right place at the right time for the right treatment so that we can optimize outcomes at the lowest spend possible. We have to get to this new world where patients get what they need at the appropriate time, because these kinds of damage control procedures and salvage maneuvers, it's just not right.